Well, good morning, good afternoon, good day. It's Teepa, and we are about to start a courageous conversation. And I want to thank my, hopefully at this point, friend, not acquaintance, Karin, for her courage in being willing to have a conversation with me. And the thing we're going to have a conversation about, we're going to talk about. But first, I'd like you to meet Karin. Karin, share a little about yourself and what you'd like folks to know.
Good morning, Teepa. I'm thankful for the chance to connect with you again. And I'm hoping that people will understand that I am actually a lot like them. I care deeply, feel passionately about a lot of things. I'm a grateful spirit. I'm grateful that I'm alive. I'm grateful that I have a chance to experience what love looks like. The world tries to frame us and give us identity. I'll give you enough just so you have a sense of my perspective a little bit. But I am honored to be a child of phenomenal parents. I didn't realize it at the time when I was growing up, but I do now, who had the courage to teach me things that are both my heritage, but also their faith, and challenge me to challenge them in what they've taught. And I'm grateful for the experiences they've given me. I've had the privilege of living my life in other cultures, other countries, and as such, I think it has been tremendously beneficial in how I view the world and how I engage with other people. I am by training, a family physician, lifestyle medicine, and preventive medicine physician.
I'm talking to a doctor. I wanted to share that. Look, she's a doctor. We didn't start off that way at all.
We didn't start off that way at all.
No, that's not what this conversation is about. But I do want to point out, she says entity or identity. We have lots of layers to us. I mean, we have layers and layers. And I think what I love, Karin, that you did is you started with, I'm a spirit first. And then I have these layers and cloaks, and they come from where I was, but now I am who I am. And part of being a physician is part of who you are, but there's more. So share a little more.
I'm also framed by that other part of my identity, which is I try to be super wife, super mom. And I also am a daughter, again, as I mentioned, of phenomenal parents, and also a daughter of parents, one who's a caregiver and one who is a parent living with dementia. My father had a history of a head injury and now has memory loss and dementia. So that has allowed us to navigate a very different space, and one that I'm actually extremely grateful for. It has definitely required somewhat of a contortionist approach to living. But I think when you exhale and, as I say, roll with it, you actually realize you're getting more of a gift than you could have imagined. I don't deny the package is not what I initially would have designed, but there's definitely a gift. So
our phrase is,
that's it.
Our phrase for dementia is, it's hardly ever easy, but it's always interesting.
Yes, it's definitely that. And I think my training has gifted me a really unique perspective, I think, in navigating that space with my family and our loved ones and the caregivers and industries we've really met along the way. And I'm also a public health policy consultant. So I think I share that. It's important for me because I look at things through the lens of, I don't just see the individual patient, I see the community and the larger space at all times.
So one of the things I love about Karin's abilities, I mean, because it's really fun for me, is she can go microscope, visual of the world, and then telescope. She can step back and look universally and then come back in, and that ability to ebb and flow with need and with observation, with questions, that detail to huge view, to say, wow, how are these things connected? How are these things coming in conflict? How are these things associated? How might this fit with this? Or how is this similar to that? How is it so different? And that's what's so exciting when she and I have a conversation and get together, and it rarely is limited by time or place. It gets both of us thinking beyond where we were.
I received the article you sent. Thank you. And I processed it a little bit because it's saying, as you in your note said, it's saying what we already know to be true. And it lends us to the question of the why and the deep dive issues. And I thought about that, your initial question, because your initial question was, how can we have a courageous conversation, how to begin a relationship when we come from very different places and backgrounds and yet have a common concern? And that's like a really big umbrella for all walks of life, whether it's dementia, race, gender issues, whatever, culture. But they all are rooted in the same truths.
And that's what my reality is that I want to appreciate that we can never be alike. If we were all alike, this doesn't even make sense. So we know we're all different in varieties of ways. And here we have a topic, this particular piece. And the first thing is like, we're coming from different places, but rather than coming from different places, I'm just like, share with me or talk to me about what your impressions are. And then if you're open, and so this is what I think I heard you saying, is that accurate?
Correct.
Or is it different? Yeah. I mean, that curiosity, our commitment is to curiosity, authenticity, and then really truly it's about relationships. And the idea, when we say our values, we try to live them, the best we can, and then we screw up and then we try again. And then the next one is that we will be compassionate. We believe in the idea of grace and compassion, and that if I'm not willing to give it, how can I get it? So, Karin, this started a while back, and we actually connected over some of your public health work back in the time when we first made a connection. It was sort of a professional sort of respect, but also curiosity of how what you were doing and what I was doing might be helpful to more people, that universal, that opportunity to provide something that might be beneficial in a time of COVID.
I'll briefly share that at the time I was trying to, again, connect dots for colleagues, for the public, and I realized that there was a disconnect between the clinical science recommendations of how to navigate COVID and infection control and the practical applications for people who are what I call frontline, the essential workers, the industries that were really caring for people, especially those living in congregate living settings like assisted living and memory care communities in this country. But I really tried to what I called bridge the public health practice, the practical guidelines for how to translate wash, wipe, ventilate, and separate for COVID to okay, what do I do when I walk into this space? I tried to make sure that it was always patient-centered, person-centered, both for the recipients of any care, but also for the people caring and doing the work. And
now you see why we were like going, yes.
It was very much a kindred
from
spirit.
the very beginning. Yeah, because what I was saying is the phrases people were using, and I was coming from that sort of public side going, okay, just in general, don't touch your face. I'm not sure how you're going to feed yourself if you're not touching your face. Those phrases are not, because right. I'm on that translation side. You're on the translation side. We both try to translate things right. so that what people are asking folks to do is doable, but it's also reasonable, because sometimes we ask people the unreasonable, and then of course they go, well, that's not reasonable, I can't do that. And it's like, well, not the way I asked you. Why did I ask it that way? And looking in the mirror and thinking, okay, how could I change what I say or what I do so that when you look at that, it makes sense to you? And our phrase at PAC is, it's not rocket science, but there is an art and a science to what we do. And if you're willing, we can figure it out, but only if you're willing.
If you're willing. Those are some really powerful words. If you're willing. If you're willing.
Yeah. So we did some things together, and I thought your work, I'll be honest, I thought your work, yes, this is the right way. This is the way to go. This would be so super cool. And unfortunately, at that place and time, that willing thing came up. And And you did that hard work of taking those things and translating them into the words and the words and the paper and the things that people need to hold on to feel safe. I mean, the things that they could point to and gesture to and show someone else, so that if someone else said, no, 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 you could go, well, look, here's where I got it. I mean, I didn't come up with that out of my head. It was like the art and the science and the practicality. And yes, it wasn't perfect, but nothing on this earth is perfect. That's not our goal, is to be perfect. It's to do the best we can. And we make a mistake, try again. And it's not blame. It's not guilt. Quit carrying it around. It just loads you down. It doesn't take you to a good place. So we went through that conversation. We moved forward. But the conversation that we were having was really about being practical, and with there were holes in the fabric. I mean, denying the holes in the fabric didn't make the holes in the fabric go away. And pretending there was something in a hole, like everybody had the right PPE. And I started saying, well, your best PPE is right here, right here. You know, these two things, if you can get them to work well for you, these are some of your best PPE. This is your first layer of PPE. Then we can work on the other layers. But if people are telling you to do things that your brain goes, this doesn't make sense, or you're using your hands in ways that you go, I feel like I'm causing harm, not doing good, then those questions you have are probably reasonable questions that you should have a place and a space to ask them, and not be asked to blindly walk. I guess these were the third thing, were your eyes. But if it's not feeling right, it may not be right. So you might want to ask for some support in a different way.
Hey folks, thanks for watching. Please like and subscribe to help us spread Teepa's positive approach message around the world. And don't forget to click the bell to get notified when new videos are posted.